Unlock your innate abilities for health. Core conversations. Core conversations.
Welcome to the Core Conversations podcast by Ampelis, where our goal is to help you fuel, use, and rest your bodies in ways that unlock its innate abilities for physical and mental health. My name is Robbie Harmon, and I'll be your host. Welcome to another episode of Core Conversations, where our goal is to help you fuel, use, and rest your bodies in ways that unlock its innate abilities for physical and mental health. My name is Robbie Harmon, and today we have Lon Henderson, who is the CEO of Ampelis, and Kim Stoddard, who plays many different roles at Ampelis. She's been on the episode before, but she really leads a lot of our efforts in creating content and engaging with people in our coaching programs and other things. So Kim has just played an instrumental role in all of this. And today we're going to have an interesting conversation that we hope is interesting anyway. It's centered around really some critiques that were shared with us from a really, really thoughtful and kind and I think intellectually honest physician, triple board certified, I think in internal medicine, rheumatology, and emergency medicine. And in a very nice, intellectually honest way, he was asked by a person who's a shareholder of our company to review Core 7, this new product that we are coming out with and sharing with people. And without knowing much about the product, or really doing much research into the ingredients or the dosing, he responded in kind of a lengthy email that we then responded to, and then he responded again, and we responded once more, and had a really interesting dialogue. And it was respectful and kind and fair. And some of the criticisms that he levied were, is that even the right word? I think levied. Yeah, were very fair, and I think even warranted. Not necessarily the aha moment I had in reading this, and if I showed you this, it's like 14 pages printed is what this two email correspondence looked like. But as I sat back and reflected, of course, the initial reaction as you work so hard on something that you think is going to be good, and somebody offers a critique of any kind, is one of a little bit of emotion and like, I want to get out my sword and defend this product. And
I was listening as I read, as I'm watching the dialogue, and sometimes I felt like a cheerleader. Other times I felt like, a trainer. Other times I wanted to jump in the ring and say, come on, let him have it. But Robert, you were just in an amazing way. You were so gentle and so appropriate. And I think the way that you disseminated the facts and the truths that we've received really had a huge impact on him.
Well, it was good. And kind of my reflection as I went through this and I thought about it before I responded was really realizing that he didn't really know anything about our product, but he was giving some feedback largely based on an industry.
Yeah.
And
exactly.
his experience with an industry rather than this specific products. He admittedly in his email said, I don't know anything about this product.
Yeah.
But what I can read in a very brief way.
Yeah. An industry that is starkly juxtaposed from a highly regulated, skilled, many years of education medical industry and the supplement industry.
Right.
Filled with copycats, filled with the newest trend, filled with science that just gets shown but immediately is produced and driven by profits. It's really a juxtaposition that's pretty stark.
Very much so.
And it really is exciting now that we've had people experience the product and they're learning more about it, or just, from this perspective, hearing different people's perspective on why Core 7 is or is not helpful, I think has really opened our eyes to see how many gaps this actually fills, this product actually fills.
That's been really fun to start to gather some of the testimonials or anecdotes of people using it. So as we launch into this, let me set the stage for, just because I think this might be helpful for some people who are listening or thinking about, supplements. Should I use them? Shouldn't I use them? Should I use this product? Is this product going to help me with what I'm dealing with? Is it not? I think the critiques that he outlined across two different emails might be helpful. So let me just start by outlining some of the things that he said, and then in our conversation, we'll go through and I think probably hit all of them while we're talking. But
Awesome.
some of the things that he said, first of all, he said supplements can't replace a well-planned diet. And I think a lot of these, we won't talk in depth about all of them right now. We'll get into it in the course of the conversation. Some of the things he said, I'll just say this, were very fair, and I think we very much agree with, right? And so I'm not going to get into that. I just want to outline the points that he made, and then we can come back to them. But he said supplements cannot replace food or a well-planned diet, which we'll agree with and we'll talk about. He said some of the claims that seem to be made by this product, this is not, I'm paraphrasing, are not sufficiently supported. So he's, we've got things on the bag that talk about how it's going to help you with sleep quality or mood and emotion or immunity or energy. And we talk about these 7 categories of benefit. And he was saying some of those things, I don't see evidence that those claims are supported. So we'll talk about that. He did talk about, because in the email correspondence, we talked about some of these anecdotes where we're starting to see people reporting different kinds of
results.
impact. And he said, well, anecdotes are not valid evidence, which we agree with, but there's a role for those. Let's talk about that. He specifically talked about certain compounds. Because I had shared that, turmeric, for example, we had some things that we put in this product with the intention of having some kind of anti-inflammatory foundation or impact for people who use this product because of how many issues are related to inflammation. And his comment was, well, there's really no evidence to suggest that things like turmeric are comparable to aspirin or Motrin for anti-inflammatory effect, which we can talk about and which we agree with. It's looking at for a different purpose, but that was a thing he said. He said, because of human variability, how different we are from person to person, it's really hard to have confidence in any kind of claim this product can make because we're not like cars where they're all manufactured and 99.9% come out exactly the same. It's like we're all different. And I think we agree with that too. He said there's limits to absorption, so getting more isn't necessarily better. And we talk about that, depth versus breadth.
Yeah.
And he said in many times, cost in this industry is more reflective of marketing than value. And so, be careful. Is this product more about, profit and marketing positioning than it is about really creating value for somebody? Is that what people are paying for?
And we agree with that.
Yeah.
Yeah. For sure.
The premise of much of what we're doing is based on that.
In the industry. Yeah.
Yeah.
So anyway, these are, I guess, categorically, that's synthesizing 14 pages of back and forth and some of the critiques that he was rendering. But I want to just then dive into this conversation with you guys about some of these things because there's a lot there to talk about. So first, let's talk about the industry. And you already mentioned it a little bit, but skepticism towards the supplement industry is very common. And maybe we even would say it's justified. I'd love to hear either of your reflections on that question or concern.
Yeah. Coming from a financial industry, overpromise is such a big deal. Overpromise is such a problem in finance. They have the SEC and many other regulatory, commissions that are there. And in this industry of supplements, it seems like overpromise is the way that you market. And when you overpromise and you don't deliver, trust is the consequence, meaning broken trust.
Eroded.
It's eroded. And how they reclaim that trust is tough. It takes years. It's difficult.
Kim, what do you think? Any insights? Why do you think it's so common in this industry?
I think there's a few reasons. I think people have tested a lot of supplements and not found a huge difference. So it's, I saw so-and-so take this on Instagram. I got it and I didn't really notice a difference. And so then you don't know if it's a supplement or you don't know if it's you. And so it's just kind of this sloshy space of like, what really works here? And I also, a lot of times I wonder how much research we do on the brands of, we trust maybe the influencer that tells us to take this, but are we really looking into why did this company decide to start a supplement company in the first place.
Mm.
And I think I never did that until we started looking into and researching what was going into all of these supplements that I'm seeing all my friends and family and all the people online take, to realize, oh my goodness, it's a house of cards. And so that's why I love to tell people the backstory of Core 7, stemming from needing this product for our clinics. That's just such a different, I really, of all the companies we researched, I don't know one that started out with that premises.
Trying to solve a problem that they were
Exactly.
seeing from
Not
caring for patients or
profits.
clients. Yeah.
And your point, Kim, a problem that we identified, but the provider is the one that directed us.
Yeah.
They looked at the commonality with all of the people they're treating. I say all, it was 95%. And one of the baseline issues is nutrition. Of course, we're seeing the statistics that are so overwhelming right now about the problem with nutrition in the world. But you're right. The other issue, too, is when you were speaking, a supplement isn't equal to a supplement, which is not equal to a supplement.
Right.
I mean, they're done in test tubes, and there's so many different standards of how they even come up with a supplement.
Mm-hmm.
And so the lack of regulation, some, of course, we do have some regulation, but
Mm-hmm.
the challenges that we have is found in sometimes a black box
Mm-hmm.
that they use to create and then market what they have.
Mm-hmm.
So maybe in summary, the industry's kind of earned some skepticism
Yep.
because, maybe there's a lot of things that are synthetic that might not be high quality, and they sell them for a high price with marketing. So
Yep.
you're paying for something that's very cheap and inexpensive, and you're paying a lot for it because there's a lot of market for margin. So there's some gaming and things that happen there. There's certainly copycat products. So you mentioned, this, and this. A lot of them actually are identical from thing to thing because people will take the same thing, put a new label on it, and just sell it based on marketing, or you mentioned influencers. And so a lot of purchases happen rather than based on personalities
Yeah.
or based on marketing rather than evidence or quality indicators. And as you mentioned, many brands overpromise, underdeliver. So I think it's, for a lot of those reasons, it's an industry, particularly from those in the medical community,
Yeah.
that they look at with some degree of skepticism, which is probably healthy.
Yeah.
Yeah.
Right.
Yeah.
So,
And maybe I just say part of the reason we didn't immediately go there, because there are so many issues that have you question if it's really valuable. So that was actually a barrier for us. Say, do we want to do this?
I remember when you came
know.
into that meeting and you're like, wait, are we going to be a supplement company?
Yeah.
Lotion in the land of lotions and potions. No
Lotions and
way.
potions.
Yeah.
And
But it
what
had
a
to be
fun
done.
journey. What a fun journey.
Had to be done.
Oh,
Yep.
We'll get into that in the conversation, but
Yeah.
legitimately it was that discussion. We were trying to find stuff to recommend.
Yep.
And we've told this story before on the podcast, but we couldn't find things that met our criteria for quality and breadth and dosing, and it just didn't, and
Efficacy.
simplicity. Yeah. And efficacy. And it didn't exist after looking for quite a
Yeah.
number of months. And so we then, before we even said create something, is there just something that we can maybe white label or pair together a few things and co-package them, and eventually said no, because that still would meet our criteria because what we were looking for doesn't exist.
Yeah.
And so that kind of goes into this next question, which is, how do you fix that? So if there's skepticism because the industry's earned it with some gamesmanship, with some, hype over efficacy and evidence, how do you repair that? What is honesty enough? If we come at this and we're really honest, can we expect people just to believe us because we think we're honest people and we're trying to tell like a complete story with a great product? Or is it fair to expect that there's going to be some skepticism?
I think there are multiple prongs to how we fix it. We're going to fix it by people who take this supplement and start seeing results. And I don't know of anything for me that's been more exciting than having people call, or people send an email, or people record something that has happened because of this supplement. And it's not a game. It's not like, we're trying to get him to say a certain thing. I mean, this isn't a promotional thing. That we are getting responses. So to me, that's that is kind of the core of excitement for me. But also, I think we're going to continue to run other tests. We're going to have every kind of medical approach that we can that's reasonable to also put proof behind all those things that we're doing. And so you've got tests, we got medicine, actual ways to prove it's right. We have ways that people are actually seeing these results in their own life. And then I think we got to play the long game.
Yeah.
We got to play the long game. I've been around enough people who've changed their diet with real food, and this is real food. This is real food. We've seen people who change their diet with real food where, as we say, little by little, a little becomes a lot, and they begin to change. And it's not just physique, it's brain, and it's thinking, and it's ahas that start to come. So I think our plan, I hope we're all into this. I know we are together. We got to be in the long game. We just got to go out there, and it's blocking and tackling, and we'll see it occur.
Yeah, I would just add, I think the transparency of our company is really appealing to people in this space because, we joked that this is Core 7 is for people who do their homework, and we expect these types of conversations. We expect resistance. We had serious resistance, and that's why we learned what we learned and had to do what we did. And so, I love and welcome those emails, and I think that our transparency as a team and creating this and telling everyone exactly what we're doing and why we're doing it is another way that will hopefully build trust.
As I was thinking about this question, and I shared when we were preparing, I thought of the business that my family was in for a long time. So my great grandfather started an automobile dealership, General Motors dealership, in 1936, and then my grandfather owned it. My dad owned and operated it. So growing up, that's what I did. I'd wash cars and get paid $1 a car if I wanted to buy a pair of shoes. And think about that. It's not a lot of cars to go buy an $80 pair of shoes. But
in my world, you're overpaid. So just watch
yeah, up in Idaho on the farm. So I grew up in that world though. And then, and cleaning, scrubbing the floors and whatever. But in college, it was a super flexible way for me to generate a little income. And I could help my dad as he was, it makes me sound old now, it's like $1 a car. Those were like one of those uphill both ways stories. Yeah. But my internet sales were just becoming a thing. These car dealerships were used to people coming in and you test drive the car and you sit down across the desk from the salesman. But the internet was changing that. This is now back in the early 2000s, and they were starting to do a significant number of transactions through online sales and marketing and getting people that lived hours away, finding a car on their lot, and then we would deliver it to them and all the things. So my dad had me help him set up all the systems and, internet tools. And so I got exposed to the sales aspect of that industry. And it was interesting because that industry has earned a negative reputation through years of their stereotypical used car salesman scenarios where, you sit across the desk and there's a little bit of negotiation that feels like it's dishonest, and they're holding something back, and they tell you they've done the best they can, and then they go talk to the manager and somehow they can do better, and all the things, the pressure tactics. And so people go into that with defenses up. And so my dad though tried to change it, right? Operationally, he had a flat commission, which is kind of like your asset management business, but a flat commission. So there's no incentive for that salesman to say, I'm going to sell it for $1,000 more. It didn't matter to them. Yeah. He just had a minimum price. It's like, this is the lowest you can sell this car for. You're going to get paid the same whether you sell it for that or $1,000 more. It doesn't matter. So everybody just sold it for the lowest price. And then, so I'm in there and I would tell people this, like, this is how the commission structure works here. Here's the invoice. Like, this is how much the dealership paid for this car. Here's the dealer holdback, and here's the kickbacks. Like, laid it all out for them. They could see everything, and they still thought that I was lying to them, because that industry had earned distrust. Yeah. And so
car dealers don't tell the truth. So this paradigm doesn't work. You're still lying. Yeah.
But I think that's, we're kind of in a similar situation. So for us to expect that just because we say we have a high quality product and nothing exists that's like it, and it's real food, and we can't expect people to believe us. But I think the things you're talking about, whether it's gathering the anecdotes and doing the studies and starting to just little by little gain this experience, knowing that we're coming from a place of not because we wanted to be in the business of selling supplements, because we were in the business of trying to help people. Little by little, hopefully we can start to overcome some of those biases. But I think it's going to be fair for people to ask those questions and approach this with skepticism, which I had to remind myself of.
And Kim, you do this just with your own persona. I mean, you're this way, and Robbie, example in this email, we welcome it.
Yeah.
I mean, really, we welcome it, because the more we hear, the more we discuss, the better we get, which means this product will continue to evolve to be even better. And so our audience is really our best critic, and our best critics are really the best givers of what we're trying to do. They have the greatest gift. So we welcome it.
Okay. So even so, welcoming skepticism doesn't necessarily mean that we have to agree with all of it. And so why is it that sometimes, and is it okay for intellectually honest, well-educated, evidence-based people to disagree? Does that ever happen? And is that appropriate? What are your thoughts?
Of course it does. It is a little bit baffling sometimes when you're looking at the exact same set of data and somebody reads it completely differently than someone else. And so I think, yes, that happens. And yes, it will continue to happen. And, they're different frameworks, not bad, but
It happens. Whether it's in politics or economics or medicine,
even
happens.
Therapy.
Yeah.
I mean,
which is kind of part of our business.
That's right. Yeah. So it happens all the time. And I think it happens also because people get different frameworks, people have different experiences. And so I expect people to disagree, and it's okay. It really is. The question here always is not just that you can disagree. I think with Core 7, the issue is, will you engage? It's okay if you disagree. Perfect example with this doctor, but will you engage? And that's where we're seeing, we have a neighbor, of course, who's also a doctor. And, he knew that we were doing this, and he kind of gave me one of those eyebrows. And I just got a phone call from his wife saying, now, I got to get some of the little packets, the sachet, what do they call them? Sachets, because we're traveling, and I just want to make sure this is with me. And I'm like, you go ask your husband to remember how this whole thing got started. It's because they pushed back, and they wanted more knowledge.
Yeah.
And knowledge is our friend.
Yeah.
Knowledge is our friend. It's our advocate.
I was sitting on the couch the other night with my daughter, who's 13, and with her grandpa, and we were talking about we want one of those little Highland cows, those mini cows. Oh my gosh! Anyway, so we're like looking on, for videos of these little cows, and they came across like a miniature sheep, and her grandpa was like, "Look how cute it smiles," and it's totally AI. Like it was just an AI video, but he saw it as completely real. Yeah. So he's like, "Look at this sheep, Kennedy, it's smiling." Smiles at you, and she like looks at him and smiles and looks at me and is like, should I tell him
what is true?
what is truth? And sometimes I see that so often in this realm of like, this is real, and you kind of like, should I tell him? Like, I love my AG1. Should I tell him? And so I think that's another thing is like, the truth and the reality of these ingredients, you just can't deny it.
Your comment, Kim, is so great on truth, because one thing that I think most people would agree with, and I'm going to put it way high on that 90% percentile, if we sat down to a meal and we brought in fresh from the garden broccoli, fresh from the garden carrots, delicious corn, maybe it's not just produce, but it's meat and fish just caught from the deep ocean or whatever. And we made this meal with all these great accoutrements and as well as spices. People would eat that and feel like you do when we travel, Europe, for example, and you just feel so good. And you feel that and say, that is the fuel that we are packaging. That beautiful meal you just looked at, that's what you're consuming every day. And if people can break it down to that lowest common denominator of the real fuel that would love if we could just have that meal every day. I mean, I would love that.
Yeah.
But it's just so impossible when some of it's shipped 1,300 and 2,200 miles away, that most delicious banana. And so that is real and that is truth. And I think people feel that versus if they went back into the laboratory and saw them trying to recreate that supplement from that real actual micronutrient coming from food. And so if people will research and people will take the time to learn, I think time is in our favor.
Yeah.
Yeah, it's interesting. Just that analogy, if we were to create a hierarchy of preference for where you get your nutrients and all the things that your body needs. Of course, the apple from the orchard, the carrot from the garden, the fish from the ocean. That's where we should get most of what we can. Everything we can, we should get from those sources.
Yeah.
If you can't get it there, where do you go? You try to supplement, with different things to fill in the gaps. And if you're going to supplement, should you do it with things that are made from those same ingredients or things that are made in a laboratory? Like the same rationale to say the reasons we should get it from food exist for why should we get it from whole food based supplements compared to synthetic supplements. And we can go more into that in a little bit.
Yeah.
But just on this topic of disagreement, a couple more reflections. Because again, there were many things in this email correspondence that we actually were very aligned on and maybe just misinterpreting it or not understanding in the original critique that we clarified. But so many times when people disagree, I think it's because they maybe have a different standard that they're using to measure against. You know what I mean?
Yeah.
So maybe to illustrate that, like pharmaceuticals, they go through before a pharmaceutical drug can be put out. They go through large scale, often multi-year, usually almost always multi-year type R&D with double-blinded, placebo-controlled studies with lots of people in them. And they come up with some degree of probability or, to the extent you can maybe, I avoid using the word certainty, but is our standard certainty based on that kind of study with nutritional supplements? Or should it be something more like we create a product like ours? And is the standard more like that's comprised of really high quality things and there's ingredient level evidence for all of those things? So you put them together and there's going to be some synergistic things, but can you make decisions based on that ingredient level evidence? Or what role do anecdotes and real actual people's experience play?
Yeah.
So what is the standard that you're using to make a decision with? That often is maybe the source of why people might disagree is because they've got different standards that they're using to measure those decisions with. But I think it's interesting in healthcare because this area that we're living in, both in our mental health business where we're trying to be more integrative and focus more on like this nutritional or integrative psychiatry approach to lifestyle and behavior and diet change rather than just take another medicine. The same holds true with the nutritional supplement space, right? And I think of my dad's experience with cancer that we've talked about in the past. And he, just in summary, dad diagnosed with pancreatic cancer. We see physicians all over, talk to physicians all over, 2 different physicians, both at world-class institutions, both world-class training, could not disagree more about the role of nutrition, certain supplementation, certain fasting protocols, as it pertained to augmenting the chemotherapy that was recommended. Both well-trained, both had access to all the evidence, and they could not disagree more about the role that nutrition and lifestyle and fasting should play in going through that process. And so is one of them wrong? Or who are we to judge? And so, what do you try? You say, here's the evidence, and you make a decision. You base it on what works. You base it on all of those things. But my point in sharing that is simply to say disagreement does not equate to one thing being bad and the other being good.
Yeah. I wonder, Robbie, I'd love your thought on this. They may disagree, but also there is some limit to current research and the exposure that certain people have to current research.
For sure.
And as fast as things are changing today, I mean, with AI in the world of research specifically in, with health and what's affecting the actual body, I wonder if we become so dogmatic and we become entrenched. And I think what's been fun about our company and fun about this journey is we are sponges. I mean, we are constantly trying to to learn what else is working, and we're looking for real results. We're looking for how it affected a person, and not just an antiquated 10-year-old study. Not dishing the work that's been in the past and not being respectful from all this research, but the world's changing pretty very, very dramatically.
Yeah, I mean, the biggest evidence I think of what you're saying is, right, like most medical training for the past 100 years or whatever, they get very little, if any, training on nutrition.
Yeah.
And I know that's changing, and there's starting to be some top-down initiative to say in the United States, medical training will include
more nutrition.
Yeah.
Yeah. My son's a good example. Is he pushed back against a couple things and pushing it back, what we're doing, and he finally came in a very humble way and said, "I really only had a semester in nutrition." He said, "All of you know more than I know right now," and that humility is so refreshing. But that's what we're asking for.
When
willingness to learn.
And it's a fun time that we're doing this too, because in the age of artificial intelligence, we have immediate access to analysis and information.
Yeah.
Some of it can be misleading. You got to be careful, of course,
Yeah,
because it
yeah.
can be fraught with confirmation bias, but still unprecedented levels of access to really good analysis and data and ability to find research and other things to support different things. So it's been a fun time to try to create something new because we have access to these tools. And I do think that that's going to change. The practice of medicine is going to change dramatically in the coming 3 to 5 to 10 years because of AI.
Yep.
Even, certainly knowledge transfer and education and training, but even surgery and other things are going to change.
Elon Musk, futuristic. Probably, I don't know if you heard that, but Elon Musk was saying in the next 3 years, we will have more surgeons that are robotic surgeons than live surgeons, because of the level of accuracy we'll get from robotics. Yeah, it's a fun time.
Fun time to do
have
this
product.
Okay, so it's okay that smart people disagree. It doesn't mean one is right, one is wrong, and that can be that kind of debate over evidence can lead to really good outcomes if done humbly and honestly. Okay, so I guess we've talked about this. I was going to ask, unless you have anything else to add, why nutrition is especially prone to disagreement. Do you think we've adequately covered that?
Yeah, I think so.
The other thing that maybe is just worth saying there is, Kim, you kind of mentioned it. I don't know if it was before or after we started recording the conversation, but I think you said it once we started recording. Nutrition's tough because sometimes changes are gradual with nutrition. Sometimes they're pretty pronounced and discernible. Sometimes they're gradual, and it's also hard to isolate those variables, like what else is going on in your life.
Yep.
And what do you attribute changes or improvements to? And unless you're a person who's really in tune, or you're wearing a Whoop band or an Oura ring or a continuous glucose monitor, are you really picking up on the changes that are happening biologically that might manifest themselves in a 10% improvement in your sleep that might add up to a lot of benefit over time? How do you perceive that unless you're really monitoring it or really focused on it? It's hard to perceive those things.
And even if you can perceive it, even if you can prove it, what financial incentive is there to help people get a full night's sleep if there's no product, there's no margin, that you can actually make on that specific product?
Yeah.
And so the lack of financial incentives, I look at the conflict of interest as where I've had my historical, world in finance. I look at, where is the conflict of interest? Where is the incentive? Why is someone selling this? Whereas you've used many times the moral margin. And so not only do you have to have it at work, but you got to have the incentive, which is the challenge.
Yep. It's harder to build $1 billion business off of broccoli sprouts than it is off of a a new pharmaceutical.
Yeah.
Amen.
GLP-1s or whatever.
Yep.
Okay. Okay. So maybe what I brought up the idea of standards, and what standard, I guess the question I have is, what standard should we hold the supplement industry to? Like a product like Core 7, we create it. And what is the right standard? Before somebody uses it, does there need to be double-blinded, placebo-controlled studies, or can people engage in things that maybe haven't yet met that level of clinical research?
I never thought of this thought until right now, even as we were kind of going through some of these questions. Those individuals who are saying pharma has such a higher standard are used to the tests and the trials that the pharmaceuticals go through. But at the same time, they're also saying that this doesn't apply, to food. I mean, this is just food. But then they will also say, out of that same breath, but food is has nutritional value and would find itself, of course, as a multi-nutrient, micronutrient, a phytonutrient. It's a chemical. It's doing things. And so, on one regard, they don't think we apply to the same standard, but at the same time, they're saying, oh, but it is it is something that can actually change your health. And so you can't have it both ways.
It's interesting.
And so I don't know if that makes sense as it did in my mind, but to me, it's saying that what is one of the great standards? Because it's food, it's real food, created. Take it, eat it, consume it. Take that dosage and start to see what the real reaction is that you're getting. And that's one standard, is what is actually happening with those who use our product.
Mm-hmm. I think it's a fair question. Excuse me. It's a fair question to ask. And, I think about all like in our business with the clinics, we've got people we're prescribing, and we've got well-trained providers who are very careful about trying to identify different factors in a person's life that might create some kind of adverse reaction to a drug that they might introduce that's intended to change them biochemically. It's a drug. They usually carry more severe side effects than do a food-based approach. But if we're talking about food-based compounds and we're using those usually don't, unless you've got like an allergic reaction to some kind of food, which is possible for some people. But food is generally safe, right? And like you said, and so if there's these things and there's evidence to suggest that you can get certain benefits from a food, why not pursue that and try it? And so it might, and if you don't have a positive benefit from it, then you can move on. But if there's evidence to suggest that it can lead to those improvements, and you can get those improvements without needing this kind of pharmaceutical or chemical that you put into your body that's intended to change your biochemistry somehow, why not try it? And I know it's interesting because you want to say that I would love to say that all of these products in the nutraceutical space are held to the same highest level standard of evidence as medicines, but they're just not. And I think there's good reasons that they're not. And I don't think those reasons mean that you should just dismiss them categorically as unhelpful, because there's both anecdotal evidence to show that they are, and there's a lot of literature and clinical research to show at an individual ingredient level that vitamin E does this, and vitamin C is helpful for that, and ashwagandha will do this, and saffron will do that, and these probiotics will do these things. So I think there's should be an openness maybe to things that have good evidence, even if they're not held to the same standard as the pharmaceutical industry in this nutritional supplement space. I don't know if that's helpful, but I do think this idea too, one of the critiques that was offered was that, you can't say with certainty you can't say with certainty that this product is going to have these benefits, whether it's mood and emotion or focus and cognitive health or energy and sleep. You can't say those things with certainty because they haven't met that clinical standard of, the pharmaceutical industry. But I think what we're going for here is plausibility. It's population level probability, right? That people will have benefits in line with what we've claimed. And I think we can stand behind those because of the tremendous amount of individual ingredient level research that is found in the core components of this product. And I think that's fair, right? That's what we're going for, is we want to give, if you take this, we can't guarantee that you are going to change your sleep by X amount, but nor can medicine, because everybody's different, and you make decisions based on probabilities and plausible outcomes rather than certainty. So we don't intend, and certainly don't mean to convey with certainty 100% of the people will have exactly these same benefits, but we do say probably you're going to experience those benefits based on what the research says.
We've taken on a unique challenge, and our challenge is that because of the source, because of the research behind each one of our ingredients, you can go deep just on an ingredient. Especially the trademarked ingredients. From clinicals to white papers to research that that's been in many different areas. And what we can't do is take the accumulation of all those ingredients into one product and be able to make a statement,
Right.
because the statements are found in each one of those ingredients.
Yep.
But in spite of that challenge, that's actually some of the drama and the fun of what we're doing,
Yep.
because we are experiencing them from those individual ingredients. And because of the absorption, the higher absorption rate that we get from all these together, we're seeing other benefits.
Yep.
And so
Yeah.
that's part of the fun of the journey.
Yeah.
Yeah, I agree. It's the thing that we have to be careful of, that sometimes the industry will get critiqued for, is overclaiming things.
Yes. Yeah.
And so we have to walk a fine line, because there's ingredients and lots of benefits to what we believe people will see here. And we might want to say, this can help. If you have depression, this can really help you. Or if you have insomnia, this can really help you. We might want to say those things because of what we've observed in real people using the product, or what the individual ingredient level data says. However, we can't.
That's right.
That is one of the regulatory things we have to navigate, is we can make these structure function claims, such as this will help enhance or improve or support, mood balance or whatever. We have to say things like that, rather than this can help your depression.
Yeah.
Even if we might believe that it will,
Yeah. It's that humility about the limits
of
this certainty. And we just have to, let them experience it.
Yeah.
But if they research it, they'll see that it's happening in those
There's some
ingredients.
benefits.
Yeah.
But that's the fine line that we have to walk, is we don't want
Right.
to overclaim, and we don't want to underclaim, because there's lots of reasons to believe that these things will help in a lot of different conditions.
Yeah.
And that's what's almost exciting, is to see different people walking different lives, having different results, whether it's like, my sugar cravings are gone, or I don't have to take a nap anymore in the afternoon, or I'm dreaming, like my sleep level is so deep, or the list goes on to what different individuals, they are evaluating the supplement according to their own life and what's happening. And some of them, I think, won't even recognize until they stop taking it and seeing. I know for me, we sold out, which is wonderful, but also means like we didn't have it for a little while. And I noticed dramatic differences during those 3 weeks that I didn't have core in a myriad of ways. But I think it's exciting for us to understand all of this, but then give it to someone, and then they come back, they return and report with, I cannot believe this is different, and this is different, and this hope and this energy that they feel, that's really exciting.
This was another critique, because I shared some of these experiences, the anecdotes, and I identified them as anecdotes. And I think we might even be getting to that later, but let's do it now. We shared some of these anecdotes in this correspondence with the physician, and I specifically noted a couple. One where a neighbor had been using the product and measuring sleep with his Garmin watch, and noted a significant improvement in the amount of deep sleep or REM sleep that he was getting. So I shared that as an anecdote, not to say this is evidence that everybody,
right?
But it's anecdote. We've had other people, you talked about dreams, talk about that, sleeping deeper and therefore dreaming more. We've had people talk about improvements in fasting glucose levels as measured by their CGMs. We've talked to other people who...
Muted appetite has been so common. Satiated appetite. Very common.
Yeah, talking about not feeling as many cravings for different foods.
Cravings.
And then some that have talked about postpartum depression.
Yeah.
We had that one video testimony from somebody who said that they felt like it's lifted them out of this funk. 2 or 3 examples of older people saying they were in a place dealing with some of those mood and emotion issues like depression. And this has totally been a game changer for them.
Yeah,
so
to emphasize the postpartum depression, it was actually on the 4th child.
Yeah.
So they've had it numerous times, and they said there was no other thing that this woman's been doing differently. So these are strong anecdotes.
So I guess my question is, what role does that play? Can we use those? Should we use those in marketing, or and telling this to people that are considering this, is that giving hope, or is that misleading because there's not enough evidence to suggest that everybody's going to have those same benefits? So I guess that's my question, is what role should those anecdotes play in the stories that we're able to share as we now lay this out there for the people to see?
We've all said this. I think it shows these are supporting claims.
Yeah.
It supports the claims that we're taking, but it's not perfection. And we have different, like you said about the auto industry, we're so different than the auto industry. And not only the conflicts of interest and profits and everything, but we are not,
biologically, we're all
not
different. Lifestyle,
automobiles.
genetically, etc.
Yeah, different DNA, and we are seeing different benefits. But to have that many nutrients going through you and that full of a product is going to have different benefits.
Mhm.
Yeah, it's going to have different benefits. But I think we show through these comments that it's supporting what we're doing. Testimonials are going to be so important, but we're still on the journey. It's not perfection.
Yeah. And give us time.
Yeah.
It'll come.
Yeah.
And I think it's worth I think there's two comments. One is I think certainly they're worth gathering. For
Yes.
the same reason a
Totally.
physician is going to ask a patient how they're doing when they start taking a new medication, because they want to confirm whether what they've read in the literature and what was told to them by the pharmaceutical companies, they want to see in practice, is that actually happening in the lives of people who are using this medication? Same thing with us, with this product, right?
Yeah.
We want to find those patterns. So we see, okay, we've read all these things and this is what the literature says should happen with these ingredients. And where are we seeing that manifest, and what patterns can we identify? And that, I think that's both interesting for us because it helps us confirm what we thought, but it also will point us to things that we should maybe improve,
emphasize in the future,
improve or pursue and further study to do.
Yeah.
Now we're going to know where we should focus clinical studies. If we're seeing patterns of this, let's prove that out with more in-depth study. And then in terms of the role, should we share it or not? Is that misleading to people if we share that, giving them false hope? I don't know. Where I land on that is, as long as we do that honestly, without suggesting that everybody's going to have that same result, I want people to feel hopeful. I want them to feel like there's a way that they can improve their sleep and that they can have more energy and that they can not feel so, anxious or depressed. Like, I want there to be hope beyond medication, because a lot of people have tried lots of medication and they don't like what it does to them.
Yeah. I hope that when we do share the success stories, that we also start to identify maybe patterns.
Yeah.
That in this kind of eating scenario with this kind of exercise, they're getting this kind of conclusion. And I think that will be helpful. The one thing that we can't feel too badly about, but whenever you see the advertisements about pharmaceuticals and they tell you what you're taking, they say, now it may cause nausea and blindness and death and and you may die, and those kind of disclaimers are coming from things that are in test tubes. And I don't think we have those same disclaimers anyway. That's coming
Giving
from
people real food. Right. Yep. Yeah, you're not going to die from the broccoli sprouts or the saffron that someone's saying, unless you've got a very rare something that we've never heard of.
Allergy.
Okay, so another, to keep us moving here, another thing that he talked about was most people that are in a position that can afford to eat well don't need supplements. So why do people that are in a position to, they live in a community or society where they've got access to food, they've got the means to provide and then purchase good food, and they're even disciplined about how they cook and eat, why do they still struggle nutritionally? Or do they? Any thoughts there?
Come on, you're a farmer. Seriously. I'm a traveler. I was once the son of a farmer. We've already used the example.
Yeah.
There is difference between an apple and an apple. And not only by how far that apple might come from a long distance to be on your table. So the quality of the apple, but food is not just food. I mean, it's not all equal. And for people who do travel, I've spent a fair amount of time in Europe, and that food performs differently. The grains perform differently inside of me than do my wife. And I think it's hard to get really great quality stuff. Why does organic berries have a double the price, delta between that and just regular berries? There's a reason, not only in taste, but also what it's doing in your body. So I think quality, you can do it, but it's just so hard. And if you did it, it's also so expensive, as we've talked about in the past.
I mean, you think about how many people actually know, according to their food, what nutrients they're actually ingesting and what's being absorbed into their body.
Mm-hmm.
I don't know how you would know that. I mean, unless you were like so
tracking your macros and your micros all the time.
Not just macro. It would have to be to calculate what is in core 7 in real food, and to know for like my weight, my digestion, it really is near impossible. I don't know how you would do it, and I don't know how you would have a life outside of calculating your food. Then
sourcing it, cooking it, calculating,
cooking it, storing it. It really, I do not know one person, and I know a lot of healthy people that actually know that to the degree of which they would have to calculate it from core 7, what their intake is each day. So, yeah.
So, I mean, there's an element to this question that is just like, maybe it's theoretically possible, but practically it's not.
Right.
Whether it's because we're just so busy, like you're on the go, so you can't eat that food that you want to eat. Maybe your mom's gone all day, after breakfast doing this and this and this and this. And so can you really eat all the things that you need to in a balanced way every day? Can your kids who are at school, can busy professional who's on the road, traveling, all those things exist as just practical barriers to getting that ideal diet, even if it were theoretically possible, that almost nobody does. And maybe they get the vitamins that they need, but think there's in almost all cases minerals that people are not getting.
Exactly.
Certainly there's probiotics and other things that are helpful for your gut that you're going to get from fermented foods that in most societies people are not getting enough of. And then the variety of those things that are helpful. And then not to mention like the omega-3s and how beneficial those are and other compounds. It's like there are things that will help your body functionally operate better, that'll improve its day-to-day functioning, whether it's the nervous system or immunity or whatever, that we just don't get because it's practically impossible, or because our soils are depleted and our crops are not coming out with the fruit that's as nutrient dense as it once was in times past or whatever. Or the food supply chain now, how we get what we get is compromising some of that nutrient density and quality. So, I mean, for all of those reasons, even though we can get and should try to have a food first mentality, right?
For sure.
Yeah. And everyone on this team has a food first mentality. I mean, that's just the way we've been trained. That's we all, at least I did, had a mother who said, eat your vegetables, eat your fruits. And it's just this dogmatic concept of I got to eat it is what's part of us. We did that little analysis. I know it was AI driven and we used a couple different sources of AI, but I was just kind of looking at it right here, organic vegetables and fruits. To get what we have in core, it's about $12 a day. That's what it costs. Organic proteins, and we're talking fish as well as eggs and liver and other things, $8 a day. The nuts, seeds, grains, about $4 a day. Functional mushrooms. I don't even wake up and say, hey, where's my functional mushroom I'm going to eat today? Things like herbs and oils that are so important, $10 a day. Fermented and probiotic foods, $4. So when you add that all up, and we're not just saying we're getting those ingredients, we've been so conscious and so conservative of saying now, again, organic fish may not be the same as just regular fish. I mean, what are we trying to get? What are we getting our sources? So we have globally sourced this. But again, this is just buying these ingredients, $38 a day. And it says up to $45 a day. And this is, again, it's AI, but it's taking what we actually have in a scoop, broken down to the very essence of all of those products and consuming it on a daily basis. It's, and I think I said this earlier, not only is it cool for me to think that we've created this and how successful this team has been, but I was looking at some of the competitors that are all using synthetics, IM8 and AG1, and looking at how much volume you get in each package. And it's ranging between, I think, 11, 12 to like 13 grams for, I think IM8 was less. AG1 was a little bit more. And what's comparing to our bag for 1 month for 30 scoops at almost, a little over 20 grams. So there's not only are we in that same ballpark in pricing and not near the margins, as we all know, but we're actually getting more content per scoop at a less expensive price
Yeah.
of much higher quality. I don't know. It's just compelling.
Yeah.
It really is compelling.
Yep.
I love it. So I guess in summary, like probably we shouldn't feel guilty about, or we shouldn't shy away from the idea that supplementation, nutritional supplementation plays a critical role.
Yeah.
And it can, and it should, because practically speaking, very few, if any of us, are getting all the things that would help our bodies function as they are capable of functioning.
Yep.
Okay. So can we just go into a minute, at a summary level, what are the problems that we're actually trying to solve with this product? Because this can be, again, the source of debate.
Yeah.
You know, people if they misperceive what we're trying to do, they might have different critiques. But let's talk about what we are trying to do with this product. What were the problems that we were seeking to solve?
Well, I think that what we just talked about is like one of the biggest ones of we're filling the gaps for people nutritionally in a way that has never been done before, and in a way that the body recognizes as good. And so I know as a mother, you know, you worry about what am I giving them what they need? Am I teaching them? You know, you think about it in spiritual and mental, all the ways, but physically, like I gave them life, but am I sustaining it for them? Like, am I able to give them the things and then their own little habits and bodies have, you know, I want to eat the Skittles for breakfast. I don't want this thing you're trying to make me eat, Mom. And so I think that having something that I can feel so good about giving them to fill those gaps, not just for myself, but for them, that's probably the biggest issue that it solves for me personally. And I think that it's solving for a large a part of the people that they are so excited for the kids product for that reason, because it is a tough battle to fight right now for our kids.
So filling the gap, like the nutritional gap that exists between what's ideal and what's real in real life, and simplifying it. So that would be a second one, like doing it in one thing rather than saying, I've got to take these 4 or 5, 6 things to get my omegas, my probiotics, and my vitamins and minerals and whatever else.
Because I've tried that. I've tried you're going to take this and then you're going to eat this gummy and then you're going to swallow this and then it's impossible. It really is. And maybe it's just
so
my
hard
kids,
hard to maintain.
But then you run out of the omega and then you run out of this and you have to reorder that. And it's just maddening to you give it your very best effort. And it's just, you know, it's an uphill battle on every front.
I think it's fatiguing too. Yeah, you get worn out. And as I've been on my own little journey, and I think the other thing besides being worn out, I'm kind of a habit guy, you know, and what I've loved here recently, I don't want to tip the curtain up too much, but we've had Kim and some members of our team looking at other ways to consume core. And for a simple habit, you know, I can drink it, and some debate the taste, but we're finding many ways that core can be added, you know, to a protein drink, or can be added to, what was the pudding? Chia pudding. Chia pudding.
Yeah, we added it to chia, and it is so delicious.
Yeah. And
I can't wait to share that recipe. It's so good.
And so I go back to not that part of the solution, but I go back to a habit. Give me a habit. I want to be, I'm just a creature of habit. And I function that way, you know, get those critical things done and focus on the more meaningful part of life. So I love that as well.
So kind of creating habit, removing complexity, simplifying it, filling those nutritional gaps, doing it with real high quality stuff that you feel confident in, you know, your body will really use. And the other thing that I would note that was highlighted in the interaction with the physician was he was comparing it to saying, you know, you really don't need something like this because you can just take a product like Centrum, which is a good multivitamin, synthetic multivitamin, but it's a common multivitamin. And they're different purposes, right? Like one is designed for filling some vitamin and mineral deficiencies or closing those gaps. And this is designed to do that and provide a whole bunch of functional benefits that will help your body and your nervous system function better. And so it's about functional impact, not just filling some gaps, was kind of the other problem we're trying to solve. Whether that was things that we observed in people at our addiction recovery business is kind of where it started, seeing some of the benefits people can get from diet, nutrition, supplementation, into our depression, anxiety treatment, into just our family lives with energy and immunity and getting through flu season and whatever else. So, and improving sleep and all those things. So this is aimed at those types of functional enhancements to your day-to-day life, not just closing those essential but limited vitamin and mineral gaps.
And would you say, Robbie and Kim, both those functional benefits that they're getting are not just for the anomalies now?
Right.
Because of the
Exactly.
broad need that we have in this whole, population, people need those functional benefits on a common level now.
Yeah.
Where they once were just for maybe more of an anomaly.
Yeah. All of us can.
Yes.
Deeper sleep is good for all of us.
Yes.
Better energy is something, and focus is something that we can all be really happy to have.
Exactly.
Yeah.
And I love that it also supports all of the what people feel like is new research on longevity and all of these things. I had some teenagers at our house and I had them try it, and one of the boys was like, "Does this have ashwagandha in it?" And I was like, "Yeah, it does." And he was like, "What?" And he's like, "Does it have probiotics in it?" I was like, "Yeah, it does." I was like, "Who are you listening to?" And his mom is a nutritionist, and so he was like naming all of these things above and beyond just the regular multivitamin things, and he was like, "Whoa!" And I just thought that was really, really fun, really fun.
That
He was
is
super
fun.
excited about it. He's like, "And it tastes good."
Like, what?
I know.
Well, and that highlights another thing that this is actually intended to solve, right? And that is when somebody who is really thinking critically about all of these things and really studying, what should I be doing to function optimally, to enhance my longevity or my health span or whatever, you're going to come up with a long list.
Yeah.
Probiotics, you're going to come up with some adaptogens or things like ashwagandha or saffron or probiotics or amino acids and creatine and protein and vitamins. You're going to come up with a long list. And then if you go try to source high quality versions of each of those things, not only is it complex, it's expensive.
Yeah.
Right. And so that was one of the other problems we solved when we started to create this, or we had in our criteria, right? We said this has to be something that's simple, people will enjoy using, and it has to be accessible for families, because if you try to get them to buy all those things, the highest quality version of those things individually, they're going to spend like $300 to $400, maybe $250 to $350 per person in a family to get those things.
Yeah.
And that wasn't sustainable. So we said, we've got to come up with a way to make that more affordable, which we hope we've done.
And you mentioned, you mentioned complexity. Complexity kills compliance. Complexity causes, again, fatigue. And so to make it simple increases compliance, increases effectiveness.
Yep. I love it. Okay. Is there anything else we want to say, maybe worth in summary fashion? We talk about this being a higher quality product. What do we mean by quality?
Well, this is one thing that we've talked about, but just to emphasize again, there's the quality that's measured by how much of an ingredient you get, and there's a quality by where do you actually get the ingredient. And I think we're fighting a little bit both by what's going on in the whole supplement world. Because as far as compliance, or I should say, quality, we're deeper in quality because we're not doing the sprinkling, which is so common. And it's common because people want that in their whatever they're taking.
Want to put a label claim
They
on
want to see it on the
in their
ingredient
claim.
list.
Yeah, and in spite of that, they can claim it if they just sprinkle a little bit there, because it's true, it's in it. But also the quality of what we've really spent time on doing global sourcing, is another side. So I kind of see both is kind of what our story is.
There's an element to quality that's points to efficacy and dosing. And then there's an element of sourcing as well. Like where are you getting those things from? Yeah. Anything you would add, Kim?
No.
And I think the more that we've learned, I wish there was more literature on this topic. There's some, and then there's some that's intuitive, right? Like, is my vitamin C better in the form of an apple versus that little orange tasty capsule or chewable that I have. Where would I rather get it? It's better in the apple. So if we can get that out of an apple with all the cofactors surrounding the reasons that it's packaged and delivered better in an apple, and put that in supplement form, that's better than that synthetic vitamin C. So that rationale carries through all of these ingredients.
Yeah. Would you also say that we've not only looked at how much vitamin C, we've also looked at absorption rates, and other factors of vitamin C and other places to get that vitamin C?
Yeah.
And where we can get the higher content and quality of vitamin C from other fruits.
Yeah, like a acerola cherry, for example.
Cherry, yeah.
And I wish this is where, like, there's emerging literature and evidence. There's some that gives us enough confidence to say this is true, this is a real thing. But there's not overwhelming amounts of evidence on this particular topic to go out and say, I'm going to die on my sword in front of a physician to say this is the most evidence-based thing. There's enough to know that there's benefit, and you can point to those things with certain vitamins, and then some of it's just intuitive. Like, is it better coming from a whole food source or from a lab?
Yeah. Not to be circular, but this is where we say, do your research, have that discovery. When someone finds out what our vitamin C is and they say, have that aha experience, say, this is just not vitamin C.
Right.
Yeah.
And I think, honestly, when we started diving into this, I was frustrated knowing how much money I had wasted on supplements.
Yeah.
And knowing that I had spent on, not for myself, but my whole family. And seeing that, like, I was thinking I was doing so much good, but I really did waste a lot of money because I didn't understand these truths.
Yeah, that's a great concept. That's a great thought.
So one of the other things that came out in this dialogue with the physician was I think he, without, again, reading into the label, he didn't at first take the time to really dive into it, but he saw this all-in-one comprehensive thing. And I think he interpreted the fact that we have all of these ingredients. So he interpreted breadth as quantity of dosing, thinking that we were trying to deliver multiples of what your recommended daily value might be for these products. And his comment was, the body can only absorb so much. And so that was a critique. And he's like, products like this deliver more than the body can absorb. And he was gracious in kind of receiving the feedback that actually this is designed to deliver
exactly what it means.
In most cases, right at 100% of the daily value. There's plus or minus a little bit in some areas for intentional purposes. But, unlike other multivitamins and things where you're going to get 1,000% of your vitamin C, his comment was, he said, that is just nonsense because it just passes through your system. We said, we actually agree with you, which is why we said we want breadth for functional impact and quality for absorption rather than giving you a super mega dose of anything, claiming that you're getting more of it to get more benefit from, because we agree with him there. Okay, we've talked about sprinkling. We've talked about why this all-in-one approach matters for just real life, because you mentioned the idea of like complexity kills compliance and decision fatigue, trying to figure out what should I do and what should I take, and that just is overwhelming. Why, Kim, maybe you start with this one, because you've played such a critical role in this, in both leading the content, but also organizing our ability to deliver the content. Why are we placing emphasis on making this an ecosystem of support, and maybe describe what that means even, rather than just selling a supplement? Why was that important to us?
So what we offer when someone subscribes to Core 7, they also have access to our nutrition group coaching and our mindfulness group coaching and our drop-in calls, which are an array of topics that support all things health, but also support you in how you're using Core 7 and how to really get the most bang for your buck. But when we created, I remember specifically having a conversation of like, nobody else does this. I don't know any other supplement company that when you sign up, you also have this personal touch of like, there's real people really trying to create real change with you. And I remember us questioning, like, is it worth it? Like, are we wasting our time? Are we wasting money trying to create an ecosystem where people don't maybe they won't, maybe they just want the product and they don't really care. And we had lots of very wonderful conversations about, we have seen way too much research tell us that people change with people, and that if you can get someone to make a connection, of a human connection, their rate of change will increase dramatically. So we said that that's what we're about. We don't just want to sell a supplement. We want to change people's lives. And so we created this ecosystem, and we've been teaching them for years. We've been teaching the workshop for years, but never just opened it up to all the subscribers. So we just barely, we're in the middle of our first kind of open subscriber mindfulness workshop. And I cannot tell you how much energy it gives me to see these people come and have all of these aha moments of like, I've never thought about breath that way. I've never thought about how much my breath impacts how stressed I feel all day long. And making those changes along with taking the supplement is just creating this beautiful, like, cocoon
Ecosystem.
of change, right?
Yeah.
Like we're just
Cocoon of change.
Yes,
I love it.
it feels like people come and they're just blossoming in this space and learning and growth, and that is exciting. That is exciting. That's why I love my job. It really is.
Mm-hmm. Kim, you say that with so much energy, but I think for those who are in these classes, it's one thing to be taught truth from a teacher. It's another thing to be taught truth from someone who's received that truth, who's practiced that truth, and are really an example of that truth. And when you teach with just tremendous authenticity. And so does, Jessica, who's teaching with you. And I think that's what's great about this little enterprise is none of us around the table thinking, do I have to drink my quart today? Do I dare do this? I mean, everybody is drinking from the punch bowl and they can't wait to go back for seconds. And that's with the trainings, that's with the educational programs, that's with coaching, long-term support. And that's why this will work. It's the real deal.
Mm-hmm.
It's probably an imperfect analogy to call the nutritional product a Trojan horse. Maybe that's conveys the wrong image, but it kind of is. Like our goal is not to sell a ton of supplements. Our goal is to help people make changes in their lives so they're able to be healthy and have energy and be stronger mentally and physically so they can spend their time on the things that matter most to them.
Yeah.
Right?
The Trojan horse is the right example. It's okay to know it takes strategy to turn people around and to change. And it requires strategy because there's a lot of headwinds that we're all fighting against to not change.
And that is the genesis of this whole thing, right?
It was the genesis.
The seeking and the iterative ways that we've done so as a team, whether it's working with companies or in addiction recovery, trying to disrupt that industry, now mental health industry, and now, the coaching work that we've done and creating all these classes, and now trying to make these classes and group coaching experiences available to people based on the principles that we've seen help people succeed. Yeah. Make those available to people that purchase this product. It just goes to the core of what we're trying to do. And that is, I think, elevating the role of nutrition and lifestyle behaviors that are not a medicine first mentality. We want to elevate the role of those things in the kind of collective psyche of, I think, the communities that we live in and in the healthcare system. And so we don't feel like we have to go to a doctor for everything or need a medication for everything if there are things that we can impact ourselves and then use those experts in places where they have really unique expertise in helping solve really entrenched problems. But
your comment reminds me of how much success we saw in structured environments with the addiction recovery. I mean, I think if people actually knew and of how successful that one, I'm going to call it now an experience or experiment was, they would say, why are you not doing that? Mm-hmm. It was so successful. But we have to take something and scale it to where we can do it in unstructured environments. Mm-hmm. We have to, and that's from nutrition to coaching to just creating that full ecosystem. And I was so excited to hear how today went. with this broader group, I can see those being just jammed wall to wall
Yeah.
with people wanting to get into those, into those great sessions. So
Yeah.
thrilling.
It is. It's exciting. I'm always a little bit envious that like I don't get to do more of those things. I get relegated to spreadsheets and PowerPoint presentations.
Well, I think if you want a group of people to give you every opportunity to change, like if you are someone who recognizes that you have some nutrition issues, some nutrient issues, some nutrition, you don't really know what you're supposed to eat or when you're supposed to eat it, and you're not really sure how to supplement or why you need certain vitamins and minerals, and you subscribe because you're like, oh, I want to drink. Like I need that. You subscribe, you start drinking, you start feeling better. You have more energy, you're sleeping better. Then you jump into Tana's nutrition class. You learn about your circadian rhythm. You learn about the gut-brain axis. You learn about from this little ball of energy. We all love Tana so much. And then you start implementing those changes. And then you think, oh, maybe I'll join that mindfulness. Like I've never meditated before, but I hear it's good for you. You jump into that. I mean, there is every opportunity for you to have a complete health transformation with Ampelis. And that's what I get excited about, is because it really is so much different than any offer that you're going to get with any other supplement company.
I would invite Kim, you, and then Robbie, somehow we need to work this into what we're doing even right now. I believe your success rate increases and your level of adherence to these changes will also increase the more you can go through this process and find a friend to take with you. I think the power of making this from what we've done with great products and great, initiatives to actually more of a movement is that they recognize the power of going through this with another person or two people or with their community will actually make with the family as a perfect part of that community, will make the greater impact. So it's a little bit of maybe I'm making a charge here and a little bit of an invitation. We need to make that part of every presentation. Who are you bringing along? There's that old German adage, only that you share, you keep. And I believe that sincerely in all elements of life. If you're willing to share it, you're going to keep it. It's true in life. It's also true with a great recipe. Yeah. And so let's invite people to, you've enjoyed this experience, bring somebody with you tomorrow.
And what is awesome as well is that I have found friendships develop within these cohorts.
Oh yeah.
And that is fun. Yeah. That is fun to see the same people showing up over and over, connecting with each other, supporting each other, sharing with each other. And so if you are feeling like, I don't know who to invite, start and find your people.
Especially in a world that's battling the loneliness epidemic.
Oh, yeah.
So what a multifactorial reason why we need to make this part of every presentation, every event.
Yeah. That's so true. I mean, anytime. Like if you're doing a race, if you're doing a marathon, you do way better if you're training with a friend.
Yes.
Or a spouse or somebody else. Or you know what I mean? It's just a true principle.
Mm-hmm.
Yeah.
And that's kind of what I love about how we've tried to approach this is a lot of the conversation today has been about, well, what's the right standard of evidence? And a lot of our answers have been kind of, well, it's different in different categories, but ultimately we've come about this a lot from the bottom up by saying, what have we actually experienced that's worked with people? And whether it's been in coaching relationships that Kim and others have been on our team, or it's been in our addiction recovery or our clinics, where have we identified patterns that actually work with nutrition, with coaching and lifestyle changes? And let's create some way to make that more accessible to everybody in a way that they can use it more simply, more affordably, and have these benefits every day in their homes. And that's really what we've tried to do. And then fortunately, along the way, we've tried to gather the evidence and support it. But practical solutions based on real results is kind of how this is originated, which is a fun way to do it.
These podcasts are fun because we get out of the weeds when we're in there laboring every day and say, oh man, I can see a little bit of the horizon. Look what's happening. Then you go back in the weeds. Yeah. To get out of the weeds on this one, I think the first invitation to even go through this summary experience we've had today should be to the doctor.
Yeah.
You should send him a note and say, thank you for the gift. And here's the result of some of those learnings that we've had because
do
of your
that.
invitation.
What would you say are some of those learnings? So what can we learn from this interchange? You guys have read through that dialogue and we've talked about it a handful of times, but he was ultimately at the conclusion of it, just generous and kind and humble and expressed admiration for the product, even as he better understood what it was trying to do and how it was designed and how we priced it relative to what others do in the industry. And he came back and kind of said, I probably missed the mark in my critiques. So seems like a really great product and I applaud you guys.
Yeah. Number one for me, because you did it so well. I mean, again, I saw the dialogue. I was on the emails. They were going back and forth. I think we invite people to have really thoughtful consideration. There's so much anger. There's so much debating over everybody's speaking. We sit on every channel and every news program, but just have some thoughtful consideration and be open-minded to read the research. Mm-hmm. And that's one for me that is a takeaway. And as you do that, remember, call us a friend, call us an ally. Please call us a friend first. I said friend first because we're on this path for the long game. I mean, we're going to go the distance on this, and it's going to take people committed to the long game to have an impact.
I love it. Yeah, that thoughtful dialogue. We'll find more discoveries if we're willing to engage, transparently, honestly, constructively, in things that we disagree on. That kind of debate, if it's done humbly, usually leads to better outcomes.
Yeah, exactly.
So, any other reflections from either of you?
I think the one that you've said, you keep pushing me on this area because I get so excited, and I know Kim knows this, but we can't overclaim. We can't be too bombastic. And when I know that I'm getting deeper REM, and I've not been having dreams for many years, and now I'm like, in fact, I was talking to my son about it. He says, Dad, you ought to record those dreams and get AI to
interpret them.
Those, and I'm thinking, wow, what a great idea. But we can't overclaim, but we do need to share results.
Yeah.
We need to have a platform where we can share and let people who are sharing those results, which are real people, let them document it and let there be this plethora of results that people can kind of comb through. So use our own research.
I love that. And it's not overclaiming. Sharing is not overclaiming. Sharing is trying to give people, maybe a new idea. It's trying to inspire a little bit of hope. It's constructively saying, like, these are patterns we're seeing. Let's try to validate that. Yeah. And I do love that you mentioned having a way to communicate that, like a forum like this that allows us to share some of those things is helpful. And it's not going to change the industry over time, this distrust that exists and skepticism that exists, but hopefully little by little.
Yeah. Consistency.
Yeah. Consistently sharing and trying to gather the evidence and documenting good outcomes can start to, increase and elevate that role of nutrition and lifestyle change in healthcare and in people's mentality about how to approach better health.
Yeah.
I loved the progression to curiosity that happened through each kind of dialogue. Whereas it was kind of like, no, these things are true. No, this is how it is. And to this kind of like, oh, maybe there are things I don't understand or didn't know. And so for me, whenever I welcome, like we've said, we welcome people's perspective, and I would hope that it leads to an openness and a curiosity that creates them wanting to try it and to be curious about how it will affect their own bodies and how these things. We're not saying it's perfect or that we've created a perfect product, but we are saying this is very, very, very good. And we'd love for you to try it.
It's a step forward for sure.
Yeah.
And I think reciprocating that curiosity and humility, right? Like not saying we have it all figured out, but not only do we need to hope people will have that as they engage with us, we need to have it as we engage with them to say, maybe somebody's going to say something that will help us improve this over time and add something to it or change something to it that will make it better for people.
Yeah.
But I think that kind of humility as was exhibited by this good doctor, we should exhibit the same.
Yep.
Yeah. Well said. Yeah. And let the evidence, and I'm going to use you as an example, Kim. Kim did not grow up on a ranch, by the way, or a farm, because I know where she was when she was young and growing up. But you are such a believer of that quality of life because of evidence. Evidence has allowed you to evolve, and evidence does that. Evidence, when you have that aha feeling and you're thinking, I'm actually getting something from what I'm doing, it tastes good. Not just taste bud good, it's physically, emotionally, spiritually, everything else that feels good. And so I think we got to point to the evidence and allow evidence to aid us all to evolve. And when we do that, this is going to be a movement.
I love it.
Yeah.
In conclusion, is there anything, if somebody's listening to this who falls into that category of skeptic, that you would want to impart that you haven't been able to share yet? Any insights? I can go. I'll say something while you're thinking.
Yeah.
As I was thinking about this episode, I just went back to the thing that we say as we introduce every podcast episode, which is our goal. I can't even remember it now, but essentially all of us, innate within us, have the ability to be healthy and resilient if we know how to use and fuel and rest our bodies in the right ways to unlock those capabilities. And I hope that this just sparks curiosity to say that's real. Like, we've observed that, and we're not saying that in every case you can avoid intense medical interventions. Those things are needed and important and life-saving and all those things. And the bodies that we've been blessed with are miraculous and so resilient. And there's an increasing number of resources out there to know how to navigate and harness some of those innate capabilities. We're learning more and more about some of these different, whether that's meditation and mindfulness practices or breath work or nutrition, you name it. But especially in the day and age of artificial intelligence, so much of that knowledge is accessible to us if we're willing to ask a few thoughtful questions and seek out a few trusted resources. And there's just things out there. Like I would even, quick shout out, I don't know if they have an Instagram account. If they do, we'll tag it, but nutritionfacts.org with Dr. Michael Greger.
Oh, yeah.
Like so much good research gathered about the role food and compounds like we have in Core 7 can play in different aspects of health. Yeah. And so just take a little bit of time to research is kind of what I would say, and use the tools that make research easier, and try to really tap into some of the capabilities that are innate within us, because we were designed to be healthy and strong.
Yeah, that's beautiful. It's great.
Yep.
Kim?
I was just going to say that oftentimes our skepticism really teaches us about ourselves. And if we can get curious about what actually is it that is making me skeptical, and hopefully we answered some of those questions today, kind of answered some of that as to, why the skepticism around this industry. But if we're honest and curious and spend some time in, like, what is it that I'm really after? What is it that I really want? I think we'll find some very open, clear answers as to why Core 7 actually does ring true. Yeah.
I love that. Very simply, the old adage, the answers lie within. I can be totally caught up in a complex issue and spend a moment in nature, a moment in where things are so simplistic, sitting by a little stream or a brook, and sometimes all the fog will start to go away, and I'll find out this is really much simpler than I made it seem to be. And of course, teaching our own model of Ampelis and this whole idea of need to culture spirituality, and whether you find that in meditation, mindfulness, nature, or believe, in God, as I do, I know the answers lie within. And we're faced with so many solutions if we'll just slow down and see that it was right in front of us. It's right in that piece of broccoli, or it's in that banana, or it might be in something that's coming from somewhere else in the world, but it's now in this micronutrient package that we call Core 7. So the answers lie within. Let's play the long game. Let's change the world.
Well, thanks for taking time, Kim, driving down from Idaho to be with us and taking time to record this conversation. I hope it's helpful to you. Core 7 was sold out after our soft launch in November. It's now back in stock and available in a big way, and we're excited to share it with you. If you do want to try it, you can use discount code podcast for a discount on your purchase, and we hope that it's benefit to you. Please share your experiences with us. We love to learn from you, and we appreciate you taking time to be with us and listen to this episode today.
Unlock your innate abilities for health. Core conversations. Core conversations.